Hello again, everyone. I am back with you per your request to answer some more of your questions around COVID-19. This is a question that I've received many times in the last few days, so I wanted to go ahead and get this one addressed. And it's a comment/question, and what people are saying, of course, is don't we do this every year? Every year there's this big media report about, oh, the flu is hitting again, and maybe it's H1N1 or maybe it's some other type of influenza. But we seem to get this report every winter that, hey, you need to watch out for fever, cough, shortness of breath, and then you also need to practice really good hygiene. So why is this different? What is the big deal? Help me understand. So I'm going to do exactly that. First of all, I will tell you there are similarities between flu and the COVID-19 virus. One of the big similarities is the way it presents. As we've discussed in previous videos, it does present very similarly with fever, cough, and of course can progress to shortness of breath. And it does have some of the associated symptoms, as we've mentioned before as well. So you can have headaches, you can have body aches, fatigue, there can be some GI symptoms involved, and typically the GI symptoms are around nausea, some diarrhea has been reported. Some people will have a little bit of vomiting as well, but those just usually aren't the predominating symptoms in general. So yes, that's a similarity between COVID-19 and flu. And of course, the other similarity being the way that it's transmitted. It's transmitted through an aerosol droplet or contact with a contaminated, desk or door handle or whatever it may be. But touching something that has the coronavirus or the COVID-19 virus on it within a water droplet, of course, you'll get it on your hands. And if you touch your face, then you will proceed to infect yourself. So practicing good hygiene, especially hand washing. Wash your hands as frequently as possible. You definitely want to do that no matter what you're worried about, whether it's flu or COVID-19. That recommendation is the same. You also want to use hand sanitizer and do some disinfecting of some kind whenever you can, whenever you have access to that. That's another recommendation that's similar. And then, of course, practicing good respiratory etiquette. What we mean by that when we say that is just remember whenever you cough or sneeze, of course, you want to cover some way, if you can. That's better than just open mouth coughing or sneezing into a room and having all these droplets go everywhere. So if nothing else, yes, this is better than nothing. But remember that you use your hands often and you touch a lot of things. You shake people's hands, you touch doorknobs, you do a lot. You touch the sink handle, even if you immediately wash your hands. So if you were to do that, you would need to wash your hands immediately before you do anything else. But possibly even better is to not use your hands to cover whenever you need to cough or sneeze, but instead use the crease of your elbow. Because whenever you cough or sneeze here, it is much, much less likely that you're actually going to use this surface of your body to touch a door handle or to shake someone's hand or anything like that. So that's kind of the common recommendations that are similar between influenza or the flu as well as COVID-19. So now let's move on to some of the key differences. One of the differences between influenza and COVID-19 is how fast it spreads. Believe it or not, influenza or the flu spreads a lot faster than COVID-19. So you heard me right, flu spreads faster than COVID-19. Another difference is the incubation period. Now, the incubation period is the time that you get infected with the virus until the time you actually start showing symptoms. So for influenza, the incubation period is actually typically 1 to 4 days, give or take, just on average. For COVID-19, the incubation period has been cited by the World Health Organization as being about 2 to 10 days. And the United States CDC has cited it being about 2 to 14 days. So on average, the COVID-19 incubation period is going to be quite a bit longer. So you may be infected and not know it until it's been 14 days later. You may have encountered that infected person 14 days ago, and now you're just now starting to show symptoms. And remember, that's definitely just an average. So there are people that will start showing symptoms outside of that range and earlier than that range as well. Another difference is actually with children. Believe it or not, our kids spread a lot of germs pretty easily around the community. And whenever it comes flu season, it's definitely a notorious means of spreading the virus. So kids definitely are a driver of transmission of influenza or the flu. Interestingly, COVID-19 doesn't seem to affect kids as much. So they may even be completely asymptomatic or have no symptoms at all. If they do have symptoms, they may be very mild in nature. The initial data that came out of the Chinese CDC actually showed 9 years old and younger not having any deaths at all, even if they were infected with COVID-19. So children are definitely one of those differences as well. Another difference between influenza and COVID-19 is the availability of vaccines. Now remember, for influenza, we have a flu vaccine that we can get every year. Now its effectiveness varies, but we do have a vaccine for it. COVID-19 does not yet have a vaccine. However, there are over 20 vaccines in production right now that are being developed. Don't know what will be available and what will go through clinical trials without any problems, but we'll have more on that data soon, I'm sure. Just know that there's a lot of work being done on it. But again, the availability of vaccines is an important difference between influenza as well as COVID-19. There's also a difference in mortality rate. Now, mortality rates, kind of like saying death rate in medicine. So there is something called a crude mortality ratio whenever we're talking about cutting edge information on a new disease or a new virus like COVID-19. And what that means is we take the number of reported deaths and we divide it by the number of reported cases. Now, again, we're so early into this right now that we know there's going to be data on the backside that'll come back and show a lot more cases and more infected people that just haven't been diagnosed yet. So we think this number is likely going to go down, but for right now, again, number of reported deaths over the number of reported cases, we're looking at a mortality rate or death rate of about 3 to 4%. Now compare that to influenza. Influenza actually has a mortality rate that is, and again, we have actual numbers to look back in history over the years. And so we've got reported cases over confirmed cases, or excuse me, reported deaths over the actual confirmed cases. So that's different than just, having reported deaths over the reported number of cases. So we have a little bit more data to go off of is basically what I'm saying with the influenza. And influenza's mortality rate has typically been well less than 0.1%. Yes, 0.1% has been the historical mortality rates associated with influenza. And as you might surmise, whenever you've got that high of a mortality rate, then you can expect that you're going to have a lot more severity in nature as well. And that's exactly right. So if you actually look at the data, the initial Chinese CDC data came out and we were able to ascertain some percentages about number of infections and about how the age groups played a difference in that, and especially in the realm of severity and in mortality. So if you look at, again, Chinese CDC data and you're looking at mortality rates, we noticed that, as I mentioned earlier, that the children have extremely low mortality rates. We're talking, initially nothing, like 9-year-olds had no mortality, no deaths if they were 9 or under. Again, going off of that initial data in the Chinese CDC. And then you had some of the other children just above 9 years old sitting kind of in that 0.2% range. And that typically were ages from about 10. And actually that 0.2% persists in the data up till about 40 years old. And then once you hit that 40-year mark, if you look at mortality rates from the age of 40 to 49, then you're actually looking at a 0.4% mortality rate. So it increased just a little bit. Now, 50 to 59 years old, you're looking at about a 1.3% mortality rate. The 60 to 69-year-old age group is looking at 3.6% in mortality rate. And then 70 to 79 years of age, we're looking at 8%. And then when you hit 80 years old and above, the mortality rate is actually greater than 14%. And all of those numbers, again, are coming from the initial CDC data. And so that's what we're looking at. Whenever you speak in terms of severity, talking about, so who's going to be symptomatic, but only mildly symptomatic, or having mild symptoms only, versus who's going to be critically ill, versus who's, just severely ill, if you will. So whenever we talk about that, we actually have data that we've looked at. And again, it's just collecting everything that we've got to go off of right now because this is continually evolving. But this severity, this is the problem with COVID-19. So for those people that say, oh, this is just another flu bug, I still don't understand what the big deal is. This is not just another flu bug. This is a much more severe virus. So for COVID-19, we now have enough data to say that about 80% of those infected are going to have mild symptoms, or they may even be asymptomatic. But 15% will be severe. And severe is defined by requiring oxygen. This may just be supplemental oxygen through a nasal cannula that sits under the nose, but regardless, the need for oxygen would make it a severe infection. And then 5% will become critically ill. And critically ill means they're going to require a ventilator to help keep them alive. So they'll be put to sleep and put on a machine, have a tube down their throat, that'll go into their lungs, and that will help pump oxygen into their lungs to try to keep them alive and hope that they can survive this illness. But it's important to also know that is what's killing the majority of people. So for people that are dying from COVID-19, the vast majority, like the data suggests over 90%, are dying of some sort of cardiorespiratory related death. In other words, the major percentage is that the lungs fail. And so you have what's called respiratory failure, where you can't breathe anymore. You can't take in oxygen. Of course, you can't survive with that. You can have cardiac failure. Some cases appear to have a primary cardiac effect from COVID-19, and others seem to be this cardiac secondary effect from the lungs, although we're still not sure if maybe the lungs are being affected by the heart or the heart's affected by the lungs. But regardless, there's still a big percentage that are dying of cardiac or a heart-related death. And then there's a percentage that is having a combination of the two, causing them to die as well. So understand that, again, how it progresses to death is actually a cardiorespiratory process, or it's heart-related and lung-related. So that's the importance of really looking out for shortness of breath. So again, if you have mild symptoms, you're not feeling short of breath, chances are that you're probably fine. But if you do start feeling short of breath, then that does trigger the indication. I mean, you've got to go seek help. And again, as I've said in other videos, this is purely for educational purposes only. So it's not to be construed as personal medical advice. So if you're ever concerned, then by all means, please go seek care. But again, the general rule of thumb that you really want to look out for is if you are having trouble breathing, then the people that do go on to end up dying are dying because of a lack of oxygen, or again, they're having a heart-related issue. So chest pain is something that's very important to look out for as well. If you start feeling chest pain, by all means, call, emergency services immediately, like a 911 if you have that, or go to your nearest emergency department. You just want to get, help immediately. So again, hopefully all this has been helpful. Again, it's my attempt to try to help offer some education and insight. Again, please don't take this as personal medical advice for you. I want you to be sure you're staying close with your primary care doctor through these times, and that you're seeking any care that you need. But by all means, please shoot me an email, as I mentioned before, if you have any other questions that I can be of service to you for in answering, to provide some education. My email is Miranda, that is spelled Miranda, at elitewealthandwellness.com. Don't hesitate to reach out. And again, as I've said before, in the meantime, be safe out there. Please quarantine yourself if you have any respiratory symptoms or infectious symptoms at all. Please, please, please. If you are strong enough to survive it, then if you go out to the world and infect others, you may be effectively killing others, especially our older population. So please, please be very cognizant of that. Again, thank you so much for listening. I'll talk to you again soon.